Moderator for joining us, and apologies that you can't be with us in person today. We're going to move on now to the next item of business, which is consideration of Business Motion 24213 in the name of Graham Day on behalf of the Parliamentary Bureau, setting out revisions for this week's business. Could I call on Graham Day to move the motion? Oh, sorry, point of order, Neil Findlay.
Point of order. I reluctantly rise to make an urgent request. Last night we saw the publication by this Parliament, excuse me, by this Parliament of evidence that had been submitted to the Committee on the Scottish Government handling of harassment complaints. That evidence has now been withdrawn at the insistence of the Crown Office and the Lord Advocate, who is a member of the Government. The very Government who he presumably advised to pursue the original flawed court case that resulted in it collapsing and £1 million of public money being lost. Presiding Officer, this is a crisis for the credibility of this Parliament, and we as members and the public we represent must hear from the Lord Advocate the reasons for this decision. We must make time today for this member of the Cabinet to come before us to answer urgent questions from members on this crisis of credibility. This cannot simply be just allowed to pass.
Can I thank Mr Findlay for the point of order? Just on information, the decision taken was taken by the SPCB. It was not taken on the insistence of the Lord Advocate. It was a decision taken by this Parliament's corporate body. These matters, well, the matter that the member raises, whether or not the Lord Advocate should come before the Parliament, would be a matter for the Bureau to decide. And I would suggest the member puts his suggestion to his business manager, who can raise it with the Bureau. Otherwise, yes, point of order, Mr Findlay.
As a follow-up to that, Presiding Officer, then we need someone to come and explain to us what has happened, because members who don't sit on the corporate body have no idea what happened in that regard. So can we have someone from the corporate body come and take questions from members on that? Because we simply cannot allow this to pass without members interrogating that decision and finding out for themselves, so we can reply to the members and people in our constituencies who are asking that very same question.
I would suggest to Mr Findlay that if he has questions for the corporate body, he can raise them. He can write to me directly or to members of the corporate body. As with any other body in this Parliament, members elect members to committees, they elect members to the corporate body, and they then entrust them to take decisions on their behalf. The corporate body will share information with members as it's fit and proper to do so, and where it can do so. And that is the trust that we have given, as we have given to every other committee of this Parliament. Thank you very much. I don't think there's any other points of order, but I'll go back to business. Call the Minister for Parliamentary Business, Graham Day, to move the motion 24213.
Move, Presiding Officer.
Thank you very much. No member has indicated they wish to speak on this motion. Therefore, the question is that motion 24213 be agreed. Are we all agreed? We are agreed. Thank you very much. Now, before we move on to the next item of business, I'm actually going to change chair, and Mr MacDonald's going to take over the chair for this item of business. I'm back for the stage 3 this afternoon.
Thank you very much. The next item of business is a statement by Nicola Sturgeon on COVID-19. The First Minister will take questions at the end of her statement, and so there should be no interventions or interruptions. And I call on Nicola Sturgeon.
Thanks, Presiding Officer. I will set out to Parliament details of the updated strategic framework on tackling COVID that the Government is publishing today. And give an assessment of the current state of the pandemic. I'll also set out our initial priorities and an indicative timeframe for cautiously easing restrictions and restoring greater normality to our lives just as quickly as it is safe and sustainable to do so. Firstly, though, a brief summary of today's statistics. The total number of positive cases reported yesterday was 655. That's 4.8% of all tests carried out. And the total number of cases is therefore 198,839. 1,076 people are currently in hospital, 65 fewer than yesterday, and 93 people are in intensive care, 6 fewer than yesterday. I regret to report, however, that in the past 24 hours a further 56 deaths were registered, and the total number of deaths under that measurement is now 7,006. As the Moderator of the General Assembly has just reminded us in his time for reflection, behind every one of these statistics is a life and a name. The Moderator's father-in-law, Mickey Wiley, and thousands of other names beside. So I want to send my condolences again to all those who have lost a loved one. Let me also quickly update on vaccinations. As of this morning, 1,465,241 people have received their first dose of the vaccine. That's an increase of 19,753 since yesterday, and it means that almost a third of the adult population in Scotland has now received the first dose, which is quite extraordinary progress. The headline number includes virtually everyone in the top 4 clinical priority groups identified by the Joint Committee for Vaccination and Immunisation, a milestone that is already saving lives. We're also well on the way to reaching everyone in Group 5. As of today, 82% of people aged 65 to 69 have had the first JAG. And as of this week, vaccine and first doses of vaccine are now being offered to people in priority Group 6. Group 6, which includes unpaid carers and people with underlying health conditions, makes up more than a fifth of the adult population. As we anticipated, the daily rate of vaccination has slowed in the past week due to a temporary dip in supply, the higher than expected uptake so far, and also the need to reserve stock so that second doses can be offered to people who received the first dose in December. However, as supplies pick up again, the rate at which we are offering first doses will accelerate once more. And indeed, if supplies allow, we will now aim to reach key vaccination targets earlier than previously planned. Our intention, supplies permitting, is to have offered first doses to everyone on the entire JCVI priority list by mid-April. That includes everyone over the age of 50 and all adults with underlying health conditions, and it accounts for more than half of the Scottish population. Beyond that, again, assuming we receive adequate supply, we will aim to have offered first doses to the entire adult population by the end of July, rather than September, as we previously anticipated. Our confidence in our ability to achieve this is a testament to how the vaccination programme has progressed so far, and I want again to thank everyone involved in planning and delivering the programme and everyone who has come forward to be vaccinated. I also want to say a few words directly to people who are on the shielding list. All of you have now been offered a first dose, and the vast majority have had one. I know that some are uncertain about whether being vaccinated changes the advice to you. Unfortunately, it doesn't yet do that. At the moment, we are advising all on the shielded list, whether or not you've had your first dose, to keep following the advice that the Chief Medical Officer sent in recent letters. Those letters and other information are available at the shielding section of the mygov.scot website. The Chief Medical Officer's advice means that if you are on the shielding list and you live in part of Scotland currently in level 4, that, of course, includes the whole of mainland Scotland, you should not go into work even if you have had one or indeed both doses of the vaccine. We will, of course, update you as and when this advice changes. I mentioned last week that we believe vaccination is already helping to reduce the number of people dying with COVID in our care homes. Last week's report from National Records of Scotland provided early evidence for that view, and yesterday the University of Edinburgh reported the initial results of a survey into COVID hospitalisations. It found that by the 4th week after a first dose being administered, the Pfizer and Oxford-AstraZeneca vaccines reduced the risk of hospitalisation from COVID by 85% and 94% respectively. That is extremely welcome and very encouraging news. The early evidence on the impact of vaccination on transmission of the virus, including that published by Public Health England yesterday, is also extremely encouraging. So while our watchwords at this stage continue to be caution and patience, there is little doubt that we now have much firmer grounds for optimism that vaccination and the other tools at our disposal do offer us a route back to greater normality. Of course, it is by being cautious, careful and patient for the next period, while the vaccination programme has time to progress, that we will make that route as safe and sustainable as possible. Taking the brakes off too quickly will allow the virus to get ahead of us again and put our progress out of lockdown into reverse. I appreciate that this can be, indeed is, a frustrating message, but it is an essential one. The point is underlined when we consider the current state of the pandemic. On the one hand, we can and should take heart from the fact that the lockdown measures adopted after Christmas have had an impact. In the first week of January, an average of 300 new cases a week were being recorded for every 100,000 people in the population. That has fallen by almost two-thirds. The figure is now just above 100. We're also now seeing lower test positivity rates and fewer COVID patients in both hospital and intensive care. But on the other hand, there are some signs that the decline in case numbers is slowing down. Last week, in fact, we recorded hardly any reduction at all. That is likely linked to the fact that the more transmissible new variant of the virus now accounts for more than 85% of all cases. And the greater transmissibility of the new variant means it is harder to suppress. So although the R number is currently below 1, it might not be very far below it, and it would likely not take very much easing right now to push it back above 1. As I said, we are very hopeful, indeed increasingly hopeful, that vaccination will have a significant impact on the R number, but that will take a bit more time. So the bottom line, and this is the clear message from our clinical advisors, is that we have quite limited scope at this stage for easing restrictions. And of course, we have just made one significant relaxation of lockdown. Yesterday, children returned to early learning in childcare settings, and pupils in primaries 1 to 3 returned to school. Some secondary school students are also now going back to school for essential practical work. So it's important that we see what impact that has on transmission before we commit to further relaxation. In short, our current position I would summarise as extremely positive and promising, and we should all take heart from that, but still quite precarious, and if we are to sustain our progress, we do need to exercise care and caution. If we're to minimise the impacts of COVID while maximising our ability to live unrestricted lives, we must get the virus to as low a level as we can and try to keep it there. And that's not some kind of ideological goal. We know from experience that it's when the virus is allowed to simmer at relatively high levels in the community that the risk of it accelerating out of control and causing more illness is most acute. And that is also when the risk of the virus mutating and new variants emerging, which could undermine our vaccines, is greatest. So maximum suppression is important for our chances of getting back to normal. So that's the context in which we are today publishing the updated strategic framework. The framework has been discussed with business organisations, trade unions, the third sector and others. I know that other parties took part in discussions at the weekend. There will be further discussions over the next couple of weeks as we put further flesh on the plans that we are setting out today. We intend to publish a further document in mid-March, giving more detail beyond that I am able to set out today on the sequencing of reopening the economy from late April onwards. However, today we set out the overall approach to and an indicative timescale for easing restrictions over the next few weeks, with a view to more substantial reopening, particularly of the economy, from late April. In considering the framework, I think is helpful to bear this in mind. At the moment, and for a bit longer, we need to rely very heavily on restrictions to suppress the virus. That's essential when it is so transmissible and when case numbers are still quite high. But in time, once the vast majority of the adult population has received at least one dose of the vaccine, we do hope that vaccination will become our main tool for suppression. However, the months between now and then will be something of a transition as we gradually rely less and less on restrictions and more on vaccination. In order to manage that transition successfully and so that we can start easing restrictions before the full impact of vaccination kicks in, we need to use a range of other measures too. Our test and protect system will continue to be vital in breaking chains of transmission as they arise. That's why we're supporting more people to self-isolate when they need to, and it's why we're expanding testing capacity so that we can test more people at work, especially in key public services and critical infrastructure roles, and so that we can use targeted community testing more, especially in areas where there seems to be stubbornly high prevalence of the virus. Travel restrictions are also essential and are likely to remain so for some time yet. We saw over the summer how new cases were imported into Scotland after the virus had almost been eliminated here, and we don't want to have that happen again if we can avoid it. In particular, we want to guard against importation of new variants of the virus, which could be more resistant to the vaccines that we're currently using. So the strategic framework rightly emphasises the importance of both travel restrictions and test and protect. They will both help us to ease restrictions safely. So let me turn now to the priorities for and the indicative timeframe for easing restrictions. As I have already emphasised, the strategic framework is deliberately cautious at this stage, but I want to be clear that in the coming weeks, if the data allows and positive trends continue, we will seek to accelerate the easing of the restrictions. However, the framework today provides detail on what, as of now, we expect our next changes to be. Firstly, it confirms that, if all goes according to plan, we will move fully back to a level system from the last week in April. At that stage, we hope that all parts of the country currently in level 4 will be able to move out of level 4 and back initially to level 3, possibly with some revision to the content of the levels, and afterwards to levels dependent on incidence and prevalence of the virus at that time. The advantages of the level system, of course, is that it will allow us to let some parts of the country move faster than others if the data supports that. Moving back to the variable level system at that time will also be contingent on us having vaccinated all JCVI priority groups 1 to 9, which, as I said earlier, we hope to have done by mid-April. That matters not only because these groups will be more protected, but also because we believe that vaccinating around half of the population will have a significant effect on reducing transmission across society as a whole. And although we don't yet know exactly how big an effect that will be, we do hope and believe it will give us the headroom to carefully ease restrictions. It is therefore from the last week of April that we would expect to see phased but significant reopening of the economy, including non-essential retail, hospitality and services like gyms and hairdressers. And of course, the more of us who are vaccinated and the more we all stick by the rules now, the faster that safe pace is likely to be. If we all stay in this together, our progress will be greater. As I said earlier, we will set out more detail in mid-March on the indicators that will guide our decisions on levels, as well as on any revision to the content of each level, and will take account of our experience and of sectoral views, and also the order in which we expect those parts of the economy that have been restricted to start reopening from the last week of April. I want now, though, to set out the journey from here to the end of April. We envisage a progressive easing of the current level 4 restrictions that apply across most of the country at intervals of at least 3 weeks, along with changes nationally on education and care home visiting, and the immediate priority will continue to be the return of schools. All of these easings will, of course, depend on an assessment that it is safe to proceed. The first easing started yesterday with the partial return of schools. In addition, universities and colleges are able to bring back a small number of students, no more than 5% of the total, where face-to-face teaching is critical. We will also ease restrictions on care home visiting from early March, and guidance was set out at the weekend. The next phase of easing will be a minimum of 3 weeks later, so indicatively from March the 15th. We hope that this will include the next phase of school return, which will start with the rest of primary school years, 4 to 7, and also getting more senior phase secondary pupils back in the classroom for at least part of their learning. We also hope in this phase to restart outdoors non-contact group sports for 12 to 17-year-olds, and we will also aim to increase the limit on outdoor mixing between households to 4 people from a maximum of 2 households, compared to 2 people from 2 households just now. And then a minimum of 3 weeks after that, so from the 5th of April, it is our hope and expectation at this stage that the stay-at-home restriction will be lifted. We would aim for any final phase of school return to take place on this date. Communal worship will also, we hope, restart around the 5th of April, albeit with restricted numbers to begin with. However, in deciding the exact date for this, we will obviously take account of the timing of major religious festivals, for example, Easter and Passover, so it may be a few days earlier when communal worship can restart. And we will seek to ease the restrictions on household gatherings further, so that at least 6 people from 2 households can meet together. In this phase, we will also begin the reopening of retail. That will start with an extension of the definition of essential retail and the removal of restrictions on click and collect. And then 3 weeks after that, as I indicated earlier, so from the 26th of April, assuming the data allows it, we will move back to levels with hopefully all of Scotland that is currently in level 4, moving to level 3, albeit with some possible modifications. And at that stage, we will begin to reopen the economy and society in the more substantial way that we are all longing for. It is, of course, important for me to stress that all of this depends on us continuing to suppress the virus now and continuing to accept some trade-offs for a period, for example, on international travel. But if we do so, I am very optimistic that we can make good progress in returning more normality to our lives and to the economy. I know this is still a cautious approach, which, though absolutely essential to control the virus and protect health, is nevertheless extremely difficult for many businesses. The Scottish Government is committed to continuing support for businesses. For example, provided we receive confirmation of consequentials in the March budget, we will support the Strategic Framework Business Fund until at least the end of June. We will also ensure that when local authority areas move out of level 4, businesses that are allowed to reopen will continue to receive payments from the fund for at least the next 4 weeks as they transition back to trading more normally. We're also considering some form of tapered support for businesses that may still face trading restrictions and reduced demand even as they are allowed to reopen, and the Finance Secretary will set out further details shortly. We will work with business organisations on these and many other issues as we continue to emerge from lockdown. In addition to the concerns of business, I know that people across the country are anxious for as much clarity as possible. I want to give as much as possible today, while avoiding giving false assurance or picking arbitrary dates that have no grounding at this stage in any objective assessment. I am as confident as I can be that the indicative staged timetable that I've set out today, from now until late April, when the economy will start to substantially reopen, is a reasonable one. And in mid-March, when we have made further progress on vaccines and have greater understanding of the impact of the initial phase of school return, I hope we can set out then more detail on the further reopening that will take place over April and May and into a summer when we hope, really hope, to be living with much greater freedoms than we are today. For now, however, the most important priority we still all have is to continue to suppress the virus. And of course, for a bit longer, that means sticking to the current lockdown rules. So please continue to stick to both the letter and the spirit of them. Please stay at home except for essential purposes. For now, don't meet people from other households indoors and follow facts when you are out and about. Please continue to work from home wherever possible. And for employers, please continue to support your employees to work from home. By doing all of this, we will make it easier for children to return to school more quickly, and we can continue to suppress the virus even as we follow this path out of lockdown. And as we do all of this, we can keep each other safe, protect the NHS, while giving the vaccination programme the time to do its work. I know how hard all of this continues to be after 11 long months of this pandemic, but the restrictions are working. The vaccination programme is motoring, and we can now see a firm way out of this. So if we all stick together and stick with it, we are now able to say with confidence that we are looking at much brighter times ahead. So please, for now though, stay at home to protect the NHS and save lives.
Thank you very much. The First Minister will now take questions on the issues raised in their statement. I intend to allow around 40 minutes for the questions, after which we will move on to the next item of business. It would be helpful if members who wish to ask a question were to press the request to speak buttons now, and I call on Ruth Davidson.
Thank you, Deputy Presiding Officer. After a year where all our lives have been put on pause, there is finally a growing sense that this might be over soon. And while it's too early to declare anything like victory, we are starting to win the race between the vaccine rollout and the spread of the virus, and we're grateful to all who are delivering the vaccine programme. The Edinburgh University study this week, which found that getting the jab can cut hospital admissions by up to a remarkable 94%, was better than could have been hoped. The success of the vaccine programme means it is now possible to start to have those important conversations with friends and family about reconnecting, about making plans, and about getting all of our lives back on track. And we welcome the information that's contained within this statement today, particularly the details on school return and care home visits. However, there is much that is not in this statement. There is nothing for the thousands of Scots who've had medical treatments, tests or operations cancelled about when and how services will get back up to speed. There's nothing for those who've already postponed huge life events like weddings for a year, about when they can walk down the aisle in front of family and friends. And there's nothing about when measures like social distancing will end and we can do something as basic as give a loved one a hug. The statement and the accompanying documents relate almost exclusively to the time between now and the 26th of April, where the First Minister intends to move the whole country to level 3 restrictions, pandemic permitting, which, to be clear, under current rules would still stop people leaving their council area. But there is nothing about what happens after the 26th of April. This isn't a route map out of COVID, it is a holding document for the next 8 weeks. And everyone understands that we might not be able to give people absolute certainty, but they were expecting the First Minister to give them some kind of hope. Many will have tuned in today precisely because they were expecting to receive that. They didn't tune in today expecting to be told to tune in again in 3 weeks' time, and they have a right to be disappointed. First Minister, why won't you let the people of Scotland know the plan to get them fully out of lockdown and back to their lives?
First Minister.
Firstly, on NHS operations and treatments, NHS remobilisation is underway. The Health Secretary keeps Parliament updated on that. I'll ask her to write to members to give a further update on that as soon as she's able to. On weddings, I would hope that as we go into the period after the end of April, we will be able to see weddings with greater numbers of people, although possibly in likelihood still restricted, taking place. As I have always done, I'm trying to be frank with people, I think we can all be much more hopeful today than we have been able to be throughout this entire pandemic, not just because we have evidence that lockdown is suppressing the virus, but that we have growing evidence that we have an alternative to lockdown restrictions that will suppress the virus instead of lockdown restrictions over the longer term, and that, of course, is vaccination. And that does allow us to say that we think by the time we get to April, we can start to open up the economy, and between now and April, we can open up in a gradual and phased way some aspects of the current restrictions that are in place. But we have to balance that with the reality, and it's not a reality I enjoy, and it's not a reality anybody enjoys, that there is still uncertainty. There is still uncertainty about the impact of the vaccination on transmission, although all of the evidence that is now emerging on that is positive, and we need to make sure that we are not opening up while the virus is still hovering and simmering at levels that are too high for us safely to do that. So the further into the future we go, the reality is any dates that we give at this stage are more arbitrary. It's like, you know, putting your finger in the wind and coming up with a date that is not firmly based in the evidence. And that is the balance that we are seeking to strike. By mid-March, we will have evidence of the impact of the early return of schools, and we will have more evidence, I hope, on the impact of vaccination. So by then we will be able to go forward a little bit more and give more detail in that April into May period. This is all going in the right direction, but this is the moment where we have to be optimistic and positive, but also patient and sensible as well. The last thing I want to be doing at any point, the last thing any of us want to be doing at any point this year is going backwards. This must be a firm and sustainable route out of lockdown, and that is what I believe that we are putting in place.
Thank you. Jackie Bailey.
Can I thank the First Minister for a statement and send my condolences to those who have lost loved ones to COVID. Most people make the reasonable assumption that once you've had your vaccination, particularly the second dose, that you are effectively good to go. But the reality is that you can still get COVID, but hopefully in a much milder form and avoiding hospitalisation. That means that testing is critically important so that we can quickly identify and contain any future outbreaks. So will the First Minister issue a revised testing strategy that includes mass community testing where appropriate to do so? And finally, I want to be optimistic and I am equally patient. But can I ask the First Minister what the ultimate goal is? Because I think it's important that people understand what lies ahead. Is it suppression of the virus using testing, tracing and vaccination, but accepting there is some risk, as we do with flu each year? Or is it elimination with zero COVID and the prospect of continuing restrictions over a longer period, including further lockdown?
First Minister.
I think the document, if my memory serves me correctly, and if it doesn't say it explicitly, it's certainly the intention is to publish a revised testing strategy to take account of our increased capacity and the new strategic objectives for testing as we come out of lockdown. The points about vaccine, that is still, there is more than one unanswered question about the impact of vaccination, but the biggest unanswered question, although it is less unanswered than it was a week ago, is exactly what impact does the vaccines have on stopping people getting and transmitting the virus. Now, the evidence that was published yesterday and the evidence that is emerging from the pharmaceutical companies is really positive, but we still need more data to be certain about that. The fact that it reduces hospitalisation and deaths is clearly good. That's the principal objective of the first phase of the vaccination programme. But of course, if it is still transmitting, then the risk of long COVID, of people still becoming ill, is there. So we need to have more data heading in the same direction as the data so far, giving us that confidence that it is reducing transmission. The more confident we become about that, the more confident we can be that the vaccine will do the job that the rest of us have been doing for the last year of living under restrictions to suppress things. On the point of elimination versus suppression, the point is you've got to try for as close to elimination as possible in order to keep the virus as low as possible. So even if you don't achieve absolutely no COVID, the very act of trying keeps it at levels that are safer for us then to open up. The problem, I think, with the flu analogy, I know what people mean, that we live with flu every year and we will have to live with the fact that COVID is a virus that exists. The problem is COVID, as we know at the moment, for some people, particularly in the shape of long COVID, can be more severe. So being complacent about it, I think, is a really dangerous thing to do. Having a conversation with the Chief Medical Officer this morning, and he used, and I've heard other people use this, that perhaps the better analogy is with measles, where measles is kept firmly under control, but there are outbreaks from time to time that we then have to make sure. So we keep it really contained, really suppressed, and deal with outbreaks. And vaccination, immunisation, does the main job of keeping it under control. I don't think that's a perfect analogy any more than the flu one is, but perhaps it is more accurate. But what's our goal? Our goal is to get back to normal life. Our goal is to be able to hug loved ones. Our goal is to be able to go about our business the way we all want to do. I think we're much closer to that because largely of the vaccination programme than we have been at any point in a year. But we just need to make sure we are doing this sensibly and with an appropriate degree of caution so that before the vaccination is doing all of the work we think it may ultimately do, we're not sending ourselves backwards.
Now, Colin Willie-Remy.
I think there is broad consensus across the country about the caution required. We must never forget there are many harms, like to mental health and to education, not just COVID, which is why we need to move to ease as soon as we can without allowing the virus to get out of control again. The measures today are broadly similar to the early measures announced by Boris Johnson yesterday, with an earlier phased easing on schools and the 2-person outdoor limit and a slightly later easing on shops, and I support that approach. There have been many false dawns on care home visiting. My hope is that this is not another one and that families separated for months can be safely together again. And finally, I'm concerned that vaccine passports are slowly gaining traction. This is despite the First Minister's scepticism when I asked about it last year. Can we have an assurance from the First Minister that vaccine passports or certificates won't be used to access public services in this country?
First Minister.
I wouldn't support the access of public services being based on anything like that. I do think it's important that we, firstly, don't get caught in any sort of preconceived idea of what people mean, because I think some people, or many people, mean different things when they talk about vaccine passports or vaccine certificates. So we shouldn't close our minds to that. Yellow fever certificates exist for travel to some countries. So there may well be scope for vaccination giving you the ability to do certain things that without vaccination you might not be able to do. I agree that there are a lot of things, and I'm not sure there is a huge amount of disagreement, certainly between the different governments in the UK on this. There's a lot of things we need to think through. We need to firstly understand, as I've talked about in other contexts, exactly what vaccination gives you in terms of protection against getting or passing on the virus. And then we do need to think about these ethical issues, about what is it reasonable to say can be accessed with a vaccine certificate if you had that and what couldn't, because there are some people who, for reasons beyond their own control, can't get vaccinated, and there are other ethical issues that arise from this. So I think it's not straightforward, it's not simple. It's one of these things that there's a real tendency to try to oversimplify, and we should guard against that. So I don't close my mind to this, but I think, like everybody else, we want to think through this carefully. And if some kind of mechanism like this can give us some greater normality back at some stage that we wouldn't otherwise get, then let's think about that, but let's think about it properly. And on the other main point that Willie Rennie raised, nobody wants it to be a false dawn on care homes. And one of the things we're saying very clearly just now on care homes, and it applies to schools, because we don't want the children who went back to school yesterday to be out again in a few weeks or a few months, is that's why we've got to do this in a steady but sustainable way, so that the things we are saying are opening up now, we get to keep going in that direction, and that definitely includes care homes.
Thank you. I now call on Patrick Harvey.
Thank you, Presiding Officer. Every single one of us just wants this to be over. We would all like nothing better than to get our lives back to normal and for us to begin tackling the deep harm that's been caused by the dreadful year that we've come through. But the Prime Minister's decision to present specific dates for the lifting of all public health measures 4 months in advance, and to describe these moves as irreversible when we don't yet know what will happen to the virus in future, seems extraordinary. Does the First Minister share my concern that many people, including in Scotland, are already taking the UK government's timeline as a cast iron promise? And looking further ahead, I also want to ask the First Minister about vaccine passports or vaccine status certificates, not just in relation to public services, but their potential use in the wider economy. Does the First Minister believe, as I do, that this could risk making the social inequality we face today even worse, and could set a dangerous precedent for the longer term that people's civil rights can be dependent on their medical history?
First Minister.
On the first point, I briefly had the Prime Minister talk this morning, where he certainly presented the 21st of June day as an aspiration, but candidly, and I think rightly, said there were no guarantees. And I think that is a reasonable position to take. I would love to stand here and say that by the 21st of June we'll all be back to normal completely. I can't say that with any certainty at all, because I don't know what the grounding for that is. I don't know what assessment gives confidence of that, which is why, much as I would like to go further out with dates, I don't think it is fair or reasonable to do that right now, because we need to make sure that we have proper assessment and a proper basis for the confidence that the things we are saying might not be able to be guaranteed, but have a reasonably good chance of being deliverable. That's my level of confidence in what I've set out today. By 2 or 3 weeks' time, I hope to have the same level of confidence when we look further into April and perhaps even beyond to May. But I think we've got to continue to treat people like grown-ups in this. People are fed up. We're all fed up with this. We all desperately want it to be over. But I think we all have developed an understanding that it can't be magicked away. We've got to get there in the right way and in a way that is going to prove to be sustainable. On vaccine certificates, passports, whatever you want to call them, I don't have much to add to what I said to Willie Rennie. Suffice to say, yes, I think we should think properly without closing our minds at this stage to what a vaccine passport or certificate might offer us, but I would never support something that deepens social inequalities or put barriers in the way of people accessing public services or took away people's civil liberties in a way that Patrick Harvey sets out. So that really just illustrates why we've got to take care. We've got to think through the practicalities and the ethics of this, and whatever direction we take, make sure that we have a broad consensus across the country behind it.
Thank you. I call Shona Robertson, to be followed by Jamie Green.
Thank you. Today's statement, I think, does give us hope that there is light at the end of the tunnel. Will the First Minister join me in recognising the extraordinary efforts of NHS Tayside staff in having delivered the first dose vaccination to over 117,000 people? That's more than a third of the adult population in Tayside. Can she also provide any further details about the most recent revised forecasts of the vaccine supply as the rollout continues, so that we can ensure that people complete their first dose, but also that we move on to the second dose as soon as possible?
First Minister.
Well, yes, I certainly do commend the efforts of NHS Tayside and the commitment and hard work of vaccination teams right across the country who are delivering this programme. The limiting factor in the programme at the moment remains supply. We have demonstrated already that we have the ability to vaccinate 400,000 people every week. We would want to increase that even further in the later stages of the programme, but we have to have the supplies of vaccine in order to do that. And the reason our vaccination rate has fallen below that in the past week is because the supplies have not been there to support it. We received updated forecasts of supply late yesterday evening, and our officials are currently doing the analysis and modelling work to understand how we flex the plans based on these forecasts so that we can vaccinate as many people as possible. But assuming the supply based on these updated forecasts allows it, the targets that I've set out today will become the targets we are working to the middle of April for the 1 to 9 groups of the GCVI priority list, everybody over 50, and then the rest of the population by the end of July, which is much earlier than we had originally anticipated. So that would be extremely good news and be very helpful to further easing if that is able to be achieved.
Thank you. Jamie Green, to be followed by Willie Coffey.
Thank you. Figures out today show that the percentage of school leavers going on to positive destinations has fallen to its lowest level in 5 years, and the gap between pupils from our most and least deprived communities doing the same has also worryingly increased. So the importance of getting pupils back into the classroom now surely takes on ever more importance and urgency. Can the First Minister confirm by which date, based on her roadmap announced today, she expects all pupils to be back in the classroom? And if, as it seems, that clashes with the start of Easter holidays, are there any plans to alter them?
First Minister.
Well, I said we hope to have the next phase of return to school, and we'll set this out next week, from the middle of March, the 15th of March. That, I would anticipate, at least would be the rest of the primary school years and as many of the senior phase pupils as we deem it is safe to do at that point. But we will have some further work to do before we can set that out in more detail. And then 3 weeks after that would be the final phase of the return to school if we hadn't got all pupils back before then. So that's what we are able to set out right now. The Easter holidays, we will continue to consider how all of this fits with the Easter holidays. But suffice to say, we want to get every young person back into face-to-face education as quickly as possible. We think we will undoubtedly do that with primary before we achieve that for all of the secondary phase in a full-time basis, but as much in-person, face-to-face, in-school education as possible, as quickly as possible, remains our driving imperative.
Willie Coffey, to be followed by Colin Smith.
Thank you. Can I ask the First Minister if patients with myalgic encephalomyelitis, otherwise known as ME or chronic fatigue syndrome, can be included with those at the highest clinical risk on our shielding list?
First Minister.
I'll double check this because I don't want to give wrong information in response to Willie Coffey's question, but I would assume patients with ME are in the Group 6 category that are currently are starting to be vaccinated now, but I will double check that point and get back to Willie Coffey if it is not correct.
Thank you. Colin Smith, to be followed by Maureen Watt.
Thank you, Presiding Officer. Even with the very limited dates given by the First Minister, it won't have escaped businesses that most will not be reopening for many months due to the health restrictions. But there was no real detail in the statement on additional economic support for those businesses. In particular, the First Minister will be aware that the recently launched discretionary funds administered by councils aimed at supporting businesses excluded by other government schemes, such as the Strategic Fund, which the First Minister mentioned, are already very much oversubscribed and limiting payouts. So can I ask the First Minister if consideration is being given to additional support specifically for those discretionary funds which help many businesses that have been left behind by the funds the First Minister mentioned in her statement?
First Minister.
Well, firstly, can I just repeat, I would be hopeful at this stage that from the last week in April, we will see a significant reopening of businesses across many sectors of the economy. And that is one of the things that the more successful we are now, we stand to achieve in that timescale. I set out in my opening remarks that we intend to continue the business support that is available through the Strategic Business Framework Fund, assuming the consequentials are confirmed in the budget, until at least the end of June, and further if necessary. We're considering further tapered support. Discretionary funding, which has already been increased in recent weeks, of course, is one of the other factors that the Finance Secretary will be considering continuing and extending should businesses need that for a longer period. But of course, but like my answer on schools, the more we suppress now and vaccinate more now, the sooner we get businesses open and trading properly, because the support that we provide, however important it is, I know most businesses would say is not a substitute for them being able to trade normally.
Maureen Watt, to be followed by Rachel Hamilton.
Thank you, Presiding Officer. Can I ask the First Minister what discussions have been had with the UK Government with regards to the continuation of the furlough scheme to reflect the needs of Scotland's approach to exiting lockdown that she has outlined today, and whether any further discussions will take place in light of today's announcement, and if they will consider a tailored approach for specific sectors?
First Minister.
The Finance Secretary will, as she always does, have discussions and make representations to the Chancellor up to the date of the budget in early March. I certainly very much hope that we will hear from the Chancellor a further extension for as long as is necessary of the furlough scheme, because I think that's really important. I think there will be a requirement in England for that, just as there is in Scotland. I think ultimately, as was the case last summer, there will be differences of a couple of weeks perhaps in our timing. In some sectors of coming out of lockdown, there will not be a massive difference in that, so that support is going to be needed. It's also important that we have the ability to tailor support in ways that we think are necessary, depending on the exact shape of the path we take.
Rachel Hamilton, to be followed by Gil Patterson.
Presiding Officer, public compliance is the most important resource that we have in controlling this virus, and the Scottish people have stuck with restrictions and made difficult sacrifices. However, after 11 months of restrictions, people need to see hope that there will be an end point. The First Minister says that in mid-March, the Scottish Government will publish proposals on further easing of restrictions based on a local approach. However, even under level 0 of the old strategic framework, there remains restrictions. And the First Minister confirmed that in mid-March, she will use all the data and evidence she has at her fingertips to give us a full route map for removing restrictions entirely, and say why she is unable to do that right now.
I'll be blunt. I think anybody who stands here right now and says that they can tell you 3, 4, 5 months from now with any certainty that all restrictions, including social distancing, can be lifted, is not doing that on the basis of any objective evidence. I hope that is the case, and I mentioned the need for us to revise as appropriate the content of different levels. I hope, and this is because of vaccinations, I hope that the game changer here that does get us to a position later this year when we are able to have something very, very close to normality is a reality. But anybody who stands here right now, tempting though it is, I'd love to stand here and say, by X date, it's back to 100% normality and COVID is over. But I wouldn't be doing that on any objective basis at all. And I don't think that's fair to people. I think I'd rather stand here. And even if people are a bit frustrated at not getting that kind of information, the information I am giving, I can actually say to people, I've got a reasonable, significant degree of confidence that it is going to be delivered. And that's the approach that I think has served us well, hasn't made life easy over the last year, but I think it's the right approach to continue to try to take.
Gil Patterson, to be followed by Sarah Boyack.
I thank the First Minister for her update and note that rightly no set dates have been given in the new framework for easing lockdown restrictions, although the timescales are easy to see if the process set out today can be accelerated in any way.
First Minister.
My apologies to Gil Patterson. He froze in the middle of his question, so but the screen froze. He didn't freeze, and I missed the middle of it. But I think I got the gist of it, which was if the data allows it. Will we accelerate this? Yes, is the answer to that. We're being deliberately cautious right now because we don't have the ability to say with certainty, but if we suddenly get, evidence that vaccinations is having a greater effect, or that, we're seeing bigger drops in the virus, we will accelerate accordingly. All of us want to be out of this as quickly as possible. But more than that, I think everybody wants to be out of this sustainably, so that when we come to be looking at next winter, we're not contemplating another lockdown. And that, will continue to mean some trade-offs for a period. Our biggest, or one of our biggest risks right now, are new variants that start to undermine the vaccine efficacy. That would be a terrible development, so that's why we have to be really careful to guard against importation of new variants, hence the need for travel restrictions at the moment.
Sarah Boyack, to be followed by Joan McCall.
First Minister, how will the Scottish Government ensure that care home residents and their families will have access to visits, given that this will depend on an assessment? I can't be alone in having had heartbreaking messages from relatives of care home assessments at residents whose mental health and well-being has been affected by lack of contact. So what support will the Scottish Government provide care home providers to ensure that visiting will both be safe and will happen?
First Minister.
The Health Secretary has been working closely with home care providers to make sure that they have the information, the guidance and the support that's necessary, and that will be an ongoing process. I'll ask the Health Secretary to provide more information to the member about the detail of that and answer any further questions that she has.
Joan McAlpine, to be followed by Edward Mountain.
Thank you. Can I warmly welcome the Government's announcement yesterday that all people with a learning disability will now be called for the vaccine in Group 6. Can I ask the First Minister how this information will be conveyed to local health and social care partnerships, and whether we are confident that this group can all be identified through their NHS number?
First Minister.
Well, firstly, I think this is an important commitment that we've made previously within Group 6. People with severe learning disabilities were included. We've taken the decision, I think rightly, to include in Group 6 those with mild or moderate learning disabilities as well. Our vaccine team will work on making sure that health boards have what support they need to identify people. When I set out this commitment yesterday, I candidly said that there will be work required to make sure that we are identifying and reaching all those in this group, and health boards working with GPs and working with, in many cases, I think the voluntary sector here are best placed to do that with appropriate support from our vaccine team as necessary.
Edward Mountain, to be followed by Kenneth Gibson.
Thank you, Presiding Officer. First Minister, there are over 2,000 patients waiting for elective orthopaedic surgery in NHS Highland. Even if operations were being carried out at full capacity, the numbers would still be increasing. 2 weeks ago, a constituent told me that she had been told she would have to wait 6 years for her new knees. First Minister, patients and consultants in the Highlands would like to know how the huge and ever-increasing orthopaedic backlogs will be reduced post the lockdown. Can you tell them?
First Minister.
So this is hugely important, and I don't want anybody to be waiting anything like 6 years for a knee replacement or any other operation. So we've got to do two things. Firstly, we've got to reduce the number of beds and the amount of capacity in our health service right now that has been taken up by COVID. That is why suppressing this virus to the lowest possible levels is really important, because any increase in transmission, again, even if the vaccine is protecting against serious illness and death, still increases the pressure on hospital capacity. So that's another reason why we've got to suppress the virus as far as we can. And then, as we are planning, and this is underway, we have to remobilise and invest in the capacity that will get through the COVID backlog of cases as quickly as possible. And there is a real focus in the Scottish Government in doing that. But I can't emphasise enough the importance of doing that first part, so that we again have a health service that is focused on the wide variety of needs and doesn't have such a significant part of its capacity dedicated to dealing with COVID.
Kenneth Gibson, to be followed by Jenny Mara.
Thank you, Presiding Officer. First Minister, across Scotland the vaccination programme has been remarkably successful. However, some vulnerable 16 and 17-year-olds at very high risk from COVID-19 have yet to be invited for vaccination, despite the best efforts of parents and guardians. Only the Pfizer vaccine is licensed for this group, which cannot be administered at home or in GP surgeries. What reassurances can be given to this vulnerable group of young people and their families that their circumstances have been fully considered and that they will now be prioritised for vaccination?
First Minister.
Anybody who is eligible for the vaccination will be called for vaccination in the priority that we are following. The Group 6 that is being vaccinated as of this week is a large number of people. It will take some time to get through all of them, but they will all be called. I'll happy to look into the particular point Kenny Gibson is raising and coming back to him in more detail. This is not necessarily the point he's raising. Health Secretary and I were having discussions yesterday with Pfizer, in fact, and talking to them, and I know other pharmaceutical companies are looking at this, at the work that is being done to enable the current vaccines to be extended into the child population as well in due course. So that is work that obviously we're not in control of the timelines of that, but we are optimistic about in the future as well. But I'll come back to Kenny Gibson on this specific point.
Jenny Mara, to be followed by Colin Beattie.
Presiding Officer, we have to prepare now for the next couple of years new COVID variants, as the First Minister said, that may emerge and may require top-up vaccines, possibly depending on the first vaccine received. For that reason, we need to be robust about recording vaccine data, who has received which vaccine, Pfizer or AstraZeneca, date, batch number, etc. Now, our health records are not as digitised as we would like, and we hear stories of people receiving vaccines out with official appointments. Can the First Minister assure me that all of this data is being recorded assiduously for every vaccine administered?
First Minister.
The vaccine management tool that we're using records which vaccine somebody is getting. The Health Secretary is telling me, so I'm taking her word on this, it also records which arm you have the vaccine in. So it's taking and recording the information that is required. There's other things we need to do to guard against new variants, travel restrictions for a period, genomic sequencing, around which the UK is a world leader in terms of genomic sequencing. We are looking at how we do much more real-time genomic sequencing, so if there are new variants in the country, we catch them before they have the chance to become more widespread, and that is going to become increasingly important. And of course the pharmaceutical companies, and as well as Pfizer yesterday, Health Secretary and I have discussed in the last couple of weeks with AstraZeneca, they are already looking at how they adapt their vaccines as new variants emerge. So lots of complexity here, but this kind of work is going to be really and increasingly important in the years ahead.
Colin Beattie, to be followed by Brian Whittle.
Now, as First Minister, what measures are being taken to vaccinate those in hospital who are not technically classed as long-term, but are in for prolonged assessment of conditions such as dementia, and whose JCVI target dates have already passed? Several constituents have contacted me, stating that local hospitals have neither supplies nor intention to vaccinate patients in this position.
First Minister.
Again, I'm happy to come back to Colin Beattie with more detail, but the general position in hospitals, I think I covered this in a question last week, is that patients will be vaccinated before they're discharged from hospital. The clinician may decide to wait until the symptoms of whatever it is they're in hospital for abate, so that there's no confusion between any side effects from the vaccine and the symptoms of the illness that they're suffering. But the general position will be that patients are vaccinated before discharge. There will, in all likelihood, be exceptions to that where a clinician thinks that is necessary. But I'll come back to Colin Beattie on more precise detail if I've missed anything in the way of information that is helpful to him.
Brian Whittle, to be followed by Annabel Ewing.
Thank you, Deputy Presiding Officer. Coming out of lockdown will inevitably focus attention on the deterioration of the country's mental health, something that was already in a crisis. There is an urgent need to set out a plan that includes support for teachers to deal with pupils returning in a heightened anxiety state, access to enhanced mental health services, including opening up access to third sector services. So can I ask the First Minister if she can tell the Chamber what considerations the Scottish Government has given to a structured plan to tackle the mental health crisis?
First Minister.
I had already, before the pandemic, embarked on plans which have been taken forward now to ensure access for all secondary schools to mental health counsellors, which is an important part of this. There is no doubt that support and provision for mental health, both for children and adolescents, but for the adult population, is going to have to increase in the years to come. The Finance Secretary set out additional funding just last week, and the Mental Health Minister, who has already produced the Mental Health Recovery Plan, will come back to Parliament in due course with further details of how that investment will be spent and the structure that will be put in place to support it.
Annabel Ewing, to be followed by Claire Baker.
Thank you, Presiding Officer. On the important issue of international travel restrictions, can the First Minister advise as to what extent the proposed indicative timetable for the easing of lockdown is predicated on such international travel restrictions remaining in place? And can the First Minister also provide an update as to where ongoing discussions with the UK Government currently stand on the issue of the desirable, more comprehensive approach to international travel quarantine that many of us here in Scotland would wish to see? Thank you.
First Minister.
There have been constructive discussions, mainly at an official level, in the last week or so with the UK Government about ways in which we can work together to try to deal practically with the fact that there is a different approach between Scotland and England. That's welcome, and we hope to continue that. We still favour a common four-nations approach in terms of travel restrictions, and we will continue to try to progress that. But as of this moment in time, that's not something that the UK Government is planning to do, as far as I'm aware. On travel restrictions, we don't want them to be in place again for longer than is necessary. I certainly hope that as we go further into the easing of lockdown, one of the things that we can do is ease travel restrictions within Scotland so that loved ones who live in different parts of the country can get together again. We all want that. International travel restrictions, I think, will have to be in place for a bit longer because of the risk of variants and the fact that different parts of the world are at different stages in terms of vaccinating their populations. Unfortunately, no matter how well we do here in Scotland and in the UK with vaccination, we can't get rid of COVID on our own. It's a global illness, so we need to be mindful of what's happening elsewhere in the world. But none of this I want to be in place for a moment longer than is necessary. But as I said last week, we have trade-offs that we need to make over this next period. The more that we accept some restriction on our ability to travel overseas, the greater normality we can get back domestically and get that back quicker than we might otherwise be able to do.
Claire Baker, to be followed by John Scott.
Thank you, Presiding Officer. I'm looking for clarity over quarantine rules for travellers. People who arrive in the UK for health treatment, not from a high-risk country, can self-isolate. Can I ask what the rules are for people returning to Scotland who have travelled overseas to receive medical treatment which is not available in the UK and may be self-funded? Often these people will be frail, receiving continuing treatment and medically vulnerable. Do they have to quarantine in a government-approved hotel, or will there be an exemption for people in these circumstances?
There is an exemption in the regulations for people who are travelling for medical treatment and for medical reasons. I don't have the regulations in front of me, so I can't read out the exact wording of that. As with all things, whether a particular exemption will apply or not in a particular case can often depend on the circumstances of the case. So if Claire Baker is asking about this for a constituent in a particular set of circumstances, if she wants to send us those circumstances, we can give a bespoke answer as opposed to a general answer. But there is a general exemption in the regulations around medical treatment.
John Scott, to be followed by Liam MacArthur.
Thank you, Presiding Officer. First Minister, amongst all the goodwill that you speak of towards the business sector, one part of that community has slipped through the cracks, namely the bed and breakfast sector. This sector is struggling hugely and badly needing targeted support. Will you look at this problem again and see if a way can be found of supporting this sector, so important for my constituents in Ayr, Prestwick and Troon and elsewhere?
First Minister.
I'm happy to take this away and talk both to the Finance Secretary and the Tourism Secretary. I know Fergus Ewing, in the latter capacity, has been very assiduous in making sure that we try to cater for the many different aspects of the tourist industry, and self-catering, bed and breakfast in particular, have been a sector that we have sought to do that. But I'll certainly take it away and see whether there's more we can do if there's a particular gap there that we've yet to fill, and what we can do to try to fill it.
Liam MacArthur, to be followed by Neil Findlay.
Thank you, Deputy Presiding Officer. The First Minister talked about the ambition to move most of Scotland out of level 4 towards the end of April. You'll recall that Orkney and Shetland remain in level 3, and my constituents would be very interested to know what the government's intentions are in relation to restrictions in our islands, and also in terms of the business support that she's confirmed will remain in place to the end of June, whether that will similarly be available to businesses in Orkney and Shetland that have been as adversely impacted as those in mainland Scotland. First Minister.
So, without saying this with absolute certainty at this stage, at that end of April point, as the parts of the country, all of the mainland and certain other parts of the country in level 4 come down to level 3, we would also certainly be hopeful that those parts of the country, Orkney and Shetland, for example, in level 3, would also be able to come down a level. That's the advantage of going back to that level system. But we would also be seeking to make sure that business support, because as I don't need to tell the member, even parts of the country that have slightly greater freedom at the moment are impacted by the inability of other people to travel there, so trading is restricted. So the continuation of business support there will be very important as well.
Finally, Neil Findlay.
The latest official statistics released by the National Records Office of Scotland show that the death rate amongst homeless people is 3 times higher than in England. As we come out of lockdown, what is the plan for all those homeless people who currently sit in temporary accommodation? And can the First Minister advise if a £100 million cut in the social housing budget will help the situation or make it worse?
First Minister.
We're investing in the social and affordable housing budget across this Parliament in a way that is delivering record numbers of new housing. We want to do more. We will do whatever we can within this budget, and if we are still in government, future budgets, to make sure we maximise our housing investment. In terms of the deaths of people homeless, Aileen Campbell reported on these statistics to Cabinet this morning. We had a pre-existing plan of work focused very much on the housing first approach to tackle homelessness and rough sleeping. That work has continued and in many respects has been accelerated during the pandemic, and we'll need to have that very firm focus as we come out of the pandemic, and the recommendations of the Homelessness Task Force will be taken forward as we do. We don't want anybody going back to rough sleeping as we come out of the pandemic.
Thank you very much. That concludes questions on the First Minister's statement, and we will move on in a moment to the next item of business.